All right, good afternoon. Thank you so much for joining us. So I want to give you a quick update on our trends in the state and talk a little bit about some forecasting or modeling work that we are doing as well. So starting here with our case trends, again, each of the gray vertical bars here shows you our daily case counts in the state, and that red line is showing you our 7-day moving average trend. As I shared with you last week, we know that there are some limitations in case reporting data as we get to really high volumes, but overall you can see that we are continuing to see a really rapid increase in the number of cases occurring in the state. We have not yet seen a decline in cases, so again, continuing on our upward trajectory. But again, as I mentioned, some challenges with case data. We know it is not comprehensive, and so we continue to look at multiple sources of data to have full situational awareness for what is happening with COVID-19 transmission in the state. So if we go to the next slide, one of the key sources of data that we are tracking right now is percent positivity data. And you can see in this figure that our percent positivity value has also continued to climb sharply. You can see that it is now nearly 30%, which is certainly the highest it has been since the beginning of the pandemic, and again reflects the high levels of disease transmission that we are seeing in the state right now. Again, we also know that this is one of the leading indicators that we have. So one of the values or data sources that we see change first when we see a change in trajectory of our cases. And at this point, we have not yet seen a flattening or an improvement in its percent positivity value. So things continuing to increase. And I'll share with you in just a moment some comparison of Colorado data to other locations, specifically as we get into the hospitalization. Next slide, please. So first, starting here with Colorado's hospitalization data. This is data that is current as of today. So today's hospital number is 1,577. I do want to point out that this is one hospitalization over our recent fall peak. So on November 23rd of 2021, we did have our most recent peak, and that was 1,576. So we are pretty level with that number of hospitalizations that we saw during that fall wave. And I'm going to talk a little bit in just a minute about how these hospitalizations are different from what we may have seen during that fall wave. Obviously, still significant strain in our healthcare system, but things are a little bit different now. Next slide, please. Moving on to the comparison of Colorado hospitalization data to hospitalization data from other locations. So this figure is showing you where different locations are in time right now, and lining all of these locations up on day 0, which is the beginning of the Omicron surge. And so we look at data in this way to try to help us understand where Colorado is right now compared to some other locations that might be ahead of us in time in their Omicron surge, to allow us to compare sort of where we are and project where we might be going based on the experience of some of those other locations. So here you can see Gauteng province, that is the furthest along. That's the largest province in South Africa. You can see that they are seeing a steady, though not rapid, decline in the number of hospitalizations there. You can also see London here, who now has started to see a decline in the number of hospitalizations there. You can see New York City, who is probably most ahead in the US right now, together with New Jersey. You can see that they have not yet started to see a decline in the number of hospitalizations there. But there is some new case data out of New York City that looks like things may be leveling off in New York City, and probably case numbers at least will be coming down soon. So again, case numbers leveling off in New York City, but they have not yet seen that change in their hospitalization trajectory. We know hospitalization data does lag behind case data. So this is really one of the sources of information that we're using right now, this curve fitting exercise, sort of looking at where Colorado is compared to locations ahead of us to try and understand what the trajectory might look like here in Colorado over the next couple of days and weeks. Another source of information that we are using right now to try and understand what the next couple of weeks might have in store for us is some modeling data, and that's what I want to share with you next. So this figure shows you modeling projections that our Colorado School of Public Health modeling team have put together. Shows you the wave of illness and hospitalizations that have occurred over the last couple of months, and then shows you our peak on November 23rd of 1,576 hospitalizations. And then if you follow that black line, that shows you our current number of hospitalizations and what our trajectory has been over the last few weeks. You'll see there's a blue line in this figure. That shows you what would have happened in Colorado based on modeling projections if we had not seen this introduction of the Omicron variant, a nice steady decline in the number of hospitalizations. Of course, that's not the case, and what we've observed is shown with that black line. And then what we're looking at with each of those other colorful bars is different modeling projections. So in this work, the modeling team is varying the potential infectiousness or severity of the Omicron variant as we're trying to learn more and more about it through various epidemiologic studies, and also changing the level of transmission control. And so what they are projecting right now is potential scenarios that are most likely is the scenario shown in green and the scenario shown in red. You'll see that we are very close to that peak level that's shown in the scenario shown in green. On January 11th, they had projected 1,479 hospitalizations. As of yesterday, that value here in Colorado was 1,488. We are now a little bit above that. And then the next scenario, that red scenario, shows a peak in hospitalizations on January 15th at 2,144. And so we believe that our likely outcome in the next couple of days is somewhere probably between those two scenarios. So that is what we are preparing for, and the healthcare system is looking at and trying to understand what the number of hospitalizations might look like in the coming days. Next slide, please. All right, I want to talk a little bit about some information that's been discussed in the media quite a bit lately, which is this difference between individuals that are hospitalized with COVID versus due to COVID. And so this is some of the data that we are collecting from hospitals across the state. What we are collecting in this data is the principal diagnosis, so the main reason that an individual is hospitalized. And this comes through hospital coding data. And what you can see if you look at this figure is that over time, typically of our total number of COVID-19 associated hospitalizations, about 80 to 90% of them are among individuals who have a primary diagnosis of COVID-19, meaning that's the main reason they're in the hospital. That remaining percentage of the 10 to 20% are in the hospital with something else, potentially being the main cause, and COVID-19 may be contributing or may be an incidental finding of their hospitalization. So looking at this figure, what you see in the last few weeks is a really rapid decrease in that percentage. And this same trend is being observed nationally and in other countries, where we're seeing that value has now dipped down to 65%. So among recent COVID-19 hospitalizations, and this is referring to hospitalizations in the last week, 65% were coded with a primary diagnosis of COVID-19 compared to a baseline of about 80 to 90%. And again, while these individuals are not primarily, this remaining 35% of individuals were not primarily hospitalized due to COVID-19, in many cases, COVID-19 is continuing to complicate their hospitalization, extend their hospitalization, and even for those that may have something else causing their hospitalization and mild COVID-19 infection, that is still complicating their hospitalization because those individuals need to be in isolation. And so that does continue to put a significant strain on our healthcare system in caring for those individuals who are actively infectious with the COVID-19 virus. Next slide, please. And with that, I'll hand it over to Director Bookman.
Thank you, Dr. Hurley, and thanks everybody for joining today. I do want to reiterate what Dr. Hurley just talked about there. I think that while understanding the difference between people hospitalized with COVID and due to COVID is an important thing, we can't minimize the impact that people who are hospitalized with COVID have on the overall healthcare system. There's more PPE utilization, their staffing ratios change. And so I don't want to minimize that while we have this critical conversation. Do want to give a brief update on the capacity of our healthcare system right now. And today, we do have a bit of a good news story here. Our ICU bed capacity is remaining stable. And in fact, when you compare it to where we were about a month ago, it is actually showing an increase. And our 7-day moving average of available ICU beds in the state is up to about 133. And we do know that at the peak of the Delta wave, we were running much closer to 100 on our 7-day moving average, and on many days we were lower than that. So we do have a significant amount of ICU beds available, and do also show a significant amount of medical surgical beds in place in the state as well. Next slide. Testing remains an absolutely critical part of our strategy. in making sure that we identify cases early so that people can stay home and ensure that we aren't spreading the virus around. We have more than 150 community testing sites across Colorado. We have seen wait times at some of these sites over the last several weeks. We are hearing that those wait times are decreasing now, but we do still strongly recommend that people make an appointment or pre-register if possible. Also, advise people to maybe identify 2 or 3 alternate testing locations that may be near their home, so that if you get to the first one and it's very crowded, you have a backup plan in place. I also do want to really urge people, don't go to the emergency department solely to get tested. Our emergency departments are to take care of people who are ill. And so if you are ill, we certainly encourage you to seek the treatment that you need. But if you are purely looking for a test, there are alternate locations for that. And the emergency department is not a place that we want to see people presenting to get care. And then, as always, really just want to reiterate the importance of getting vaccinated. And we know that there is a significant decrease in hospitalizations and deaths for those who are vaccinated. For those who are up to date on their vaccinations. And so if you haven't had the opportunity yet to go and get your vaccine, it's free, it's effective, it's life-saving. I really want to encourage all Coloradans to go ahead and take that step to get the first dose if they haven't gotten that yet. And anybody who is eligible for an additional dose of your mRNA, your Pfizer, your Moderna shot, or your J&J, we really want to encourage people, very significant increase in antibodies that occurs after getting that additional dose. So with that, I will turn it over to Joe.
Thanks, Director Bookman. Good afternoon. My name is Joe Holman, and I'm the COVID-19 marketing specialist here at CDPHE. Today, I'll be providing you all with an update on our marketing efforts for the COVID-19 vaccines. Our phase 3 marketing efforts are part of a phase strategy of providing information on vaccines to Coloradans. As a refresher, I just wanted to run through what we've already done. Phase 1, which ran from January to March 2021, encouraged Coloradans to seek out accurate information about the vaccines from reliable sources such as CDPHE and the CDC. And it featured medical professionals as trusted messengers of that information. Phase 2, which ran from April to September 2021, aimed at increasing access to vaccine information and appointments statewide, as well as reduce hesitancy across a wide variety of audiences. And it was part of the state strategy of vaccinating 70% of the population by July 4th and doing so equitably. That brings us to phase 3, which focuses on 3 main audiences. We want to provide information and promotion of third doses to eligible Coloradans. We want to provide information and promotion of vaccines for adults 18 years and older who are still unvaccinated. And we want to provide information and promotion of vaccines for parents and guardians of unvaccinated 5 to 11-year-olds. All of these campaigns launched last year, with booster ads going out in late October, followed by the unvaccinated adults campaign launching in late November, and finally the 5 to 11 campaign launching in late December. All of the campaigns will continue to run for the next 6 to 8 weeks, and funds allocated for this phase currently total $3 million. Next slide, please. This slide just shows you a media mix across the 3 campaigns. As you can see, the campaigns utilize traditional media such as broadcast, print, and digital, as well as other methods like social media, streaming, and non-traditional out-of-home advertisements like posters in gas stations, laundromats, and convenience stores. Next slide. This slide just shows you some of the creative from the booster third dose campaign. In late October, we launched PSAs statewide featuring Dr. Gabriella Frank and Dr. Rachel Herlihy that encouraged people to get their boosters before the holiday season, which was then followed by digital ads that are currently running, and you can see some of that sampling right here on this slide. Next slide, please. This is a small sample of some of the creative assets developed for the Unvaccinated Adults campaign. This campaign features testimonials of Coloradans who lost loved ones due to COVID-19, encouraging people to get vaccinated as a form of protection against COVID, as well as showing how people can talk to their loved ones about getting vaccinated. Next slide. And finally, this slide shows a sampling of some of the creative assets developed as part of the 5 to 11 campaign. It encourages parents to learn more about how vaccines protect their children and highlights the important role that parents play in their children's health. And with that, I will kick it back to Brian.
Thank you so much, Joe. Director Bookman and Dr. Herlihy will go ahead and move on to the media Q&A portion of this afternoon's press conference. We'll use the raise hand function located at the bottom of the console, and we'll get through first questions first, please. If we have time at the end, we can circle back for follow-ups or second questions. Please state your name and your outlet before asking your question. And if there's any questions we can't get to or any questions that were not presented about in today's press conference, please email us at media_info@state.co.us. Let's go ahead and start with Meg Wingberger. Go ahead.
Hello, this is Meg from the Denver Post. I wanted to ask about the findings on incidental hospitalizations versus hospitalizations primarily due to COVID. And some of the other Denver area hospitals have been reporting kind of the inverse, that they had about 60% that they thought were incidental. And I just wanted to find out, do you think it varies a lot by region, or do you have maybe different definitions of how you would attribute those hospitalizations, or what you think the difference might be?
Yeah, great question. I think I would probably agree with both of your ideas there on potential differences. So one of them certainly could be the definition that we are using. The data that we are using is looking specifically at the primary diagnosis and whether or not COVID-19 was the primary diagnosis. I'm not certain what the terms for the analysis that individual hospitals may be using. But I think there also could quite likely be variability by region. And so a hospital in one region of the state might be having a very different experience from a hospital in another region of the state. I would also say that these data are going to lag a little bit. So it takes time for these codes to be applied to hospitalizations and then for that data to get to us. And so it could be that there's just differences in timing in some of those analyses as well.
All right, let's go to Seth.
Hi, Seth Clayman from the Gazette. Dr. Hurley, with the projections that you gave, and it sounds like you guys think it's going to be somewhere in between those projections, what impact is that going to have on the hospital system sort of as it stands today? Thanks.
Yes, so our healthcare system obviously continues to be under substantial strain. We know that there's obviously hospitalizations due to COVID-19, but lots of the other conditions that individuals are being hospitalized for right now. We know that there's a backlog of surgical cases, of other care that individuals need that is sort of waiting behind this wave of COVID-19. And so we know that our healthcare system is going to continue to be under strain for quite a while. As far as what it means specifically for the Omicron numbers, if we look at that modeling data, or if we look at that data where we kind of fit the Colorado curve to other locations, it does look like that time to peak number of hospitalizations could be sometime around in the next week or so, give or take some days, of course. We know that not every location is going to be exactly the same, and there are going to be lots of variability in characteristics of the population from one location to another. But that's what we expect could potentially occur. What that timing might look like. But Director Bookman, is there anything you'd want to add to that about the experience of our hospitals right now?
I think I would just, remind the public that our frontline healthcare workers have been doing this for almost 2 years now. They're heroes on the front lines, both in the hospitals and our first responders, and they are under continued stress. Our healthcare system in Colorado has shown great resiliency, and they have surged to meet the demands of COVID. And on this trajectory, it's gonna, they're gonna need to surge again. And this continues to put stress on them. We're in close contact and partnership with them on a regular basis. And we'll see where things take us over the next week.
Let's go to Alex Rose.
Hey guys, thanks again for having this availability. Just going back to the incidental COVID compared to because of COVID, Dr. Herlihy, I know you and I spoke about this yesterday, but I'm wondering if there's any data to back up the idea that somebody may be more likely to be in the hospital because of COVID based on their vaccination status, that incidental COVID may be happening more in people who are fully vaccinated and or boosted. What data is there out there that could support that?
So we are in the process right now of updating our analysis we shared with you several weeks ago, where we looked at the risk of hospitalization among individuals who have received a booster dose of the vaccine versus 2 doses of vaccine versus those that are unvaccinated. And really that's where those conclusions come from. So we know that individuals who have received a booster dose are least likely to require hospitalization due to a COVID-19 infection, followed by those that have received 2 doses of vaccine. And then obviously the highest risk of hospitalization is going to continue to be among the unvaccinated population right now. And so we know that individuals who are unvaccinated are much more likely to be hospitalized due to COVID-19. And we also hear from our clinicians in the hospital that they tend to see that the patients that are most severely ill, those that are in the ICU, do tend to be unvaccinated individuals and do tend to be trending towards younger age groups than they had throughout the pandemic. We tend to see that individuals that are fully vaccinated in hospitalizations more often tend to be individuals that have underlying medical conditions and other reasons that might be complicating their hospitalization.
All right, let's go to Univision.
Hello, I'm Jesus Carrasquel from Univision. We have been contacted by several JBS workers in Greeley at the meat plant, reporting maybe some of the reinfected with coronavirus. So we want to know if is this a new outbreak? If they just continue with the health and cleaning measures? What you just can tell us about that?
So we are aware of the outbreak at JBS. These outbreaks are handled majoritively at the local level. And so Weld County Public Health is leading the outbreak investigation here in consultation with our epidemiology teams. And we'll continue to support them as they work through this outbreak.
All right, let's go to Ellis Arnold.
Hey everyone, this is Ellis Arnold with Colorado Community Media and Newspapers. Thanks for taking our questions today. I saw that the graph of hospitalizations due to COVID versus with COVID went back to January 2021. Can you give us a rough picture of what the percentage of hospitalizations due to COVID was before January 21, like going back to the start of the pandemic? Was it still around 80 to 90%, or did it vary from that?
It's a good question. I am not certain. I don't know. I don't have that data in front of me right now. I don't know if that was a limitation and when we started receiving some of that coding type data, if that's why the analysis was cut off on that date, or if it was just for a convenience sample to show that data. But I can get back to my analytic team and get the information to you.
All right, let's go to Allison Borden.
Hey, this is Allison Borden from Colorado Public Radio News. My question is about hospital strain. We've implemented both the crisis of care standards for staffing and then for EMS last week. Is there a red line that we would implement crisis of care standards for patients? Is it, a staff ratio? Is it a number of cases? Is it a number of hospitalizations? Is that something you guys are looking at?
There's no red line. I don't think there's a number there. And we are in constant communication with our hospitals. And at this point, there's no indication of any need to move towards crisis standards of care in our hospitals. We did do the staffing crisis standards of care to provide our hospitals with a bit more flexibility in how they use their staff. We did put the EMS crisis standards of care into place, which again is a way to free up some EMS staff and ensure that those crucial 911 resources are being used for the most critical patients. But at this point, no indication that we're going to move anywhere towards hospital crisis standards of care.
Great, let's go to Katie Pelton.
Hi there, Katie Pelton with KKTV 11 News in Colorado Springs. Thank you so much for holding this. I was wondering, the CDC may recommend that people start wearing the N95 or KN95 face masks. And I was wondering if the state or the governor's office has any plans in the works to start supplying those across the state, like maybe how you're doing the at-home testing program where it's mailed to homes across the state. I was wondering if this is something the state is looking into. Those N95 masks obviously are a lot more expensive for folks. And I know you do supply them to places like schools and hospitals, but wondering if that could be more widespread or if there are any discussion in the works. Thank you.
We are having those conversations and we are carefully looking at the updated recommendations at the federal level about moving away from cloth masks to those medical grade masks. And so I would just say, stay tuned, more information to come.
All right, let's go to Chris Vanderveen.
Chris Vanderveen with 9 News. I'm going to apologize in front end because I may be asking a question that's already been asked, but I want to be as specific as I can. I've been listening in and out of another conversation I've been having with someone else. When it comes to hospitalizations and this idea now that we're just seeing a lot of people that are there with COVID, but not necessarily due to COVID. Hospitalizations have always been the key metric for cities, the state, myself, looking for how this is all going. So my question is it now inappropriate to look at hospitalizations alone as a key metric because it's now impossible to compare apples to apples? It's impossible to compare what's happening today to 6 months ago because we have so many people, more people in the system today who have COVID incidentally to their visit to the hospital, to why they're in the hospital to begin with. So that's the first question. And the second question is, if not hospitalizations, what's a key metric that we should be looking at? I think potentially hospital capacity, but I'm curious what you guys think.
Yeah, Chris, I think you ask a very good question, and I always defer to Dr. Herlihy on the right metrics here. But I would also say that hospitalizations are obviously a key indicator here. And throughout this pandemic, we have also been looking at our hospital capacity. And so looking at our ICU beds, looking at our medical surgical beds, it is so important for us to understand trajectory. And it's also important for us to communicate publicly information that the public can compare to other times in the pandemic. And that helps everybody understand where we are in a wave. And so I do think it is critically important that we continue to talk about that hospitalization number. And simultaneously, from an operational perspective, we continue to evaluate, on a daily basis, how many ICU beds are available, how many medical surgical beds are available, and what is the trend line there. So Dr. Herlihy, I don't know if I missed anything there.
No, I think that's exactly what I was going to say. So I think it's really not just looking at COVID-19 hospitalizations, which again continue to be really important to look at. And I would say that, as I mentioned a couple minutes ago, that even if someone has a primary diagnosis of something other than COVID-19, COVID-19 is still complicating their hospitalization for a variety of reasons, either making them more ill and extending the length of their hospitalization, or making it more challenging for our healthcare providers to provide care to those individuals. So 2 measures that we're looking at right now. So obviously the hospitalization numbers, COVID-19 specific hospitalization numbers, but also looking at total hospitalization numbers, or the inverse of that, which Director Bookman was describing, which is the number of beds that are still available in the state and the number of ICU beds available in the state. And Director Bookman shared some of that data during the presentation today. So that's the same data that we are looking at right now to monitor capacity.
All right, let's go to Meg Wingerter.
Hello again. I wanted to ask about the projections that the hospitalizations could be peaking as soon as later this week. Because as I recall in previous waves, you'd see cases kind of peak or level off, and then hospitalization about a week later. So I wondered, since we're not really seeing any moderating on cases yet, is there something different about this wave that makes you think we're near the peak, or kind of how we came to that place? Thank you.
Yeah, it's a good question. I don't have a great answer for you other than I'm looking at multiple sources of data to try and understand our trajectory. So looking at percent positivity data, case data, and hospitalization data in other locations. So looking at that first figure I showed you where we're trying to line up Colorado data with other locations, those other locations did see cases peak before hospitalizations peaked, but not by a long time frame. The one example I was just recently talking about a few minutes ago was New York City, where we've seen cases peak there, but hospitalizations haven't yet. So I think it'll be very insightful to see over the next 2 or 3 days if we start to see hospitalizations come down in New York City. So I don't have a great answer for you. I think lots of unknowns about what the timing is going to look like exactly, but we're looking at multiple sources of data to try and understand where we are.
All right, let's go back to Seth.
Hi, Seth again from the Gazette. Dr. Hurley or Scott, is the state tracking the number of infections or quarantine isolation for healthcare workers in this wave? And if so, what is that number? And if not, do you have sort of a general sense of what that trend line looks right now? Thanks.
That is not something that we are specifically tracking at this point.
All right, thank you everyone for joining us this afternoon, and to Director Bookman, Dr. Hurley, and Joe Holman for joining us to present. If there's any questions that we were not able to get to during this Q&A session, please email us at media_info@state.co.us, and we'll get you some information as soon as we can. Thanks again for joining us. Have a great afternoon.